Great day, everyone. It is a beautiful day here in Texas. Beautiful and sunny and actually warm here in December. I believe it's 82 degrees and I love it. Just finished the Medicare annual enrollment period, AEP, and December 7th. That's October 15th through December 7th. And I actually enjoy that period because I get to help senior citizens or disabled citizens who are basically Medicare beneficiaries. That's the time of year when you can look at what's available to you in your area for the next year's benefits, and you can decide, if you want to go with a Medicare Advantage plan, which one is best for you, which one covers your doctors and your medications and things like that. So I enjoy that period of time. Um, People, when I first started, okay, I had my license. In fact, I got my insurance license, a general lines license, um, in 2008, April of 2008. I was managing a home health agency in Plano, Texas, and the one of my CNAs had an appointment with her insurance man, and he came in. They used my office, and I was able to listen to what he had to say, about what his services and everything. And so I was very impressed with it. And I thought, everybody that I know needs what he is offering. So when he finished with her, I asked him, what do I do? How do I get to do what you do? And so he pointed me in the right direction and helped me to get my license. And then, I kind of made my way through, and I love where I am today. Um, so anyway, someone reached out to me years ago, several years ago, to um, have me to come with their company for the annual enrollment period, AEP. And so I went through the weeks of training, and it was so extensive and everything, and confusing and complex. And I thought, how do these senior citizens um, know what to do? How do they even maneuver through this information? Because it was vast, it was a lot of information. So, anyways, I did that, and so I enjoyed that time when I can actually get with seniors. Sometimes I take calls from seniors in all across the states. I have 50. I'm licensed in 50 states, so I can take calls all across the country. And then I love reaching out to family members. And just a couple of years ago, I was reaching out to family members that I'd not talked to about it, and I'm always, almost in tears because they didn't know, and they didn't ask me, or anything, and I hadn't asked them, if I could assist them with it. But I was so happy to find out what they were doing and to be able to guide them in the right direction and help them get the coverage for their situation. So I was just so happy to do that. One of the things that people don't know is when you turn 65 years of age, everybody you have to get a drug plan. You have to get a drug plan, or they will penalize you for every year that you don't have a drug plan. So whether you take medications or not, you're required when you turn 65 to get a drug plan, unless you're still on your company's insurance, and maybe you have a drug plan through that. But if you don't, and you take out original Medicare, then you have to also get a drug plan. What you will get um, is Part B when you get Medicare. That is given to you pretty much. Part A, I don't know what I said. Part A is given to you pretty much. You have to take out, you should take out, and most people do take out Part B. Part B makes it to where you're able to take out Part C. Part C is the Medicare Advantage plan. Okay, Medicare Advantage plans are private insurance companies that actually take over what Medicare does, the coverage that Medicare does for you. These private insurance companies will take over that and and take care of you um, instead of original Medicare. The thing that you want to know about that is they have to be just as good as original Medicare. And Medicare is who approves them. So you don't have to worry. Medicare is the ones is who approves the Medicare Advantage plans. Okay, um, so Part A is for your hospitals. Part B is for your doctors and your doctor facilities and like that. And then if you have those two, then you can take advantage of Part C. Part C, like I said, is the Medicare Advantage plans, and they offer things that original Medicare does not offer, or they don't offer. Things like they may have dental coverage. They usually do dental coverage, um, health club, over the counter, where you can buy different things over the counter quarterly. You can they send you a card or whatever to where you can buy things over the counter. Um, let's see, I said gym membership, dental, transportation. Transportation, you will get so many trips per year where you can, a van or someone will come to your door and pick you up and take you to your doctor's appointment and back home. And so those are, those and some other uh, extra things that you get if you have a Medicare Advantage plan versus just original Medicare. Uh, Sometimes people will have original Medicare, and because original Medicare is going to pay 80% of your coverage of your health um, expenses. And so sometimes people, excuse me, sometimes people will take out a supplemental plan. If you do that, if you have original Medicare and you decide that you want to take out a supplemental plan to take up the other 20%, to take care of the other 20% that Medicare does not pay, you can do that. But if you don't go to the hospital, if you don't go to the doctor many times a year, then you really don't need a supplemental plan. The other thing about a supplemental plan is uh, they are kind of expensive. You'll have to pay for them, um, 100 or sometimes a few $100s per month to pay for a supplemental plan. Um, and the other thing about that is you'll have original Medicare, you take out a supplement plan, and then you'll also have to pay for a drug plan separately. Okay, so those are some expenses that if you don't have to go to the doctor very often, then a Medicare Advantage plan is what I would recommend for anyone because you can get a Medicare Advantage plan that will have a built-in drug plan. Okay, they will take care of everything that Medicare was going to take care of, plus extra things like I said, um, dental, transportation, over the counter, gym memberships, a lot of different extra things. And oftentimes you can get an awesome Medicare Advantage plan for $0. And so I'm not going to go on and on, but we just finished that, and I always feel good when I can talk to some of my family and friends and even strangers and just let them know what's available to them. Um, what I want to add is if you do not um, take out a drug plan when you turn 65, they will penalize you for the rest of your life until you take out that drug plan. Okay, so if your penalty has gone up to say $25 when you realize or someone's able to tell you that you need to do that, whatever amount it has built up to, well, then you'll have to pay that amount for the rest of your life. Okay, so that's one thing that I want people to know. Sometimes people think they can't afford, um, a Medicare Advantage or whatever. But that's why we're here, and I try my very best to reach out to people, to let them know, family, friends, even strangers, because it's a lot of information. And so I've spent years and years of um, of training with it, and so to be able to help someone. Also, what we do is in the financial services business we do life insurance, and that's something huge that that we try to get out to as many people as we can. I can remember sitting down with this young couple in Dallas, Texas, and the husband was the sole provider for the family. The wife stayed at home and took care of their little son. And so we sat down, and I asked him, as the breadwinner for the family, what do you have in place in case something happens to you for your family? He was proud and happy to tell me that he had um, $300,000 worth of life insurance for his family. But when we looked at it, reevaluated what he had, we found out that he only had accidental death, which really meant that he had nothing because, if you have accidental death, chances are very good that it's not going to be an accident. And I'm going to go ahead and just put my neck out here and just say that oftentimes, even if you're injured in an accident and you have, say, you're in an auto accident and you have a heart attack, well, they're going to say that the heart attack is what killed you, not the accident, so that they don't have to pay that you know that claim. So anyway, but yeah, I love what I do. We do life insurance, health insurance, Medicare, investments, investments. Um, I'm really, I'm really, trying to get the information out to as many um, of our people, especially in the Black community. Everybody, but especially in the Black community, um, there's not enough information out there um, as far as life insurance, and there's a lot of misinformation about things because if you take out a life insurance policy as a young person, you can um, get a very inexpensive. You can get a lot of coverage inexpensively, is what I'm trying to say. And you want to get that coverage before you're diagnosed with something because once you're diagnosed, no company is going to want to take the risk of taking you, because they're in business to make money. And so if they take someone that's already has cancer or some serious illness or disease, excuse me, then they're basically throwing away money. But yeah, so just wanted to sit down on this beautiful day and just say a little something about the AEP annual enrollment period for Medicare. And of course, even though there's the period uh, where you can look at what's available to you, if you have Medicare and Medicaid both, then you can switch anytime during the year. That's something else that you should know. Another thing that I like um, to tell people is call Social Security and see if you qualify for Medicaid, if you qualify for low income subsidy, that can help you. Um, it doesn't hurt, to ask. Just I advise you to call and see if you qualify so that you can get those benefits. They're out there for you. But anyway, I just wanted to say hello and say a little bit about what I do. I love what I do, um, and I help people get their license. It's the best thing that I could have done. I'm so happy that God sent that insurance man to my office so that I could learn about it and to be able to help people the way that I do, the way that I'm able to. I can remember, and I'm gonna end with this. I can remember I was employed with the state of Texas, and on the billboard was an article of an 87-year-old lady. Someone asked her the question, if you could live your life all over again, what would you do differently? And the lady thought about it and she said, I would laugh more. I would walk barefoot in the grass more. And I would tell the people that I love them more. And so I always try to encourage people that, life is so short. Life is so short. Even if you live a long life, like my mom, she lived 101 and a half years, praise God. But life is so short. And so I encourage you to laugh more. Laughter is like a dose of medicine, I've been told. Um, Walk barefoot in the park or do whatever makes you feel good. Do it while you have life. And by all means, tell the people that you love them more. Have a great day, everyone. God bless you.